If you are a man over 60 and you have noticed that simple activities like standing up from a chair, walking upstairs, or even coughing seem to trigger an uncomfortable pressure in your lower abdomen, I want you to listen carefully, because what I am about to share with you could change how you feel every single day. These symptoms are not just inevitable parts of aging, they are signals from your body, quiet messages that something deeper is happening, something that affects millions of men but rarely gets discussed openly. My name is Dr. Jonathan Reed, and I have spent over 15 years as a urologist helping men reclaim their comfort, their confidence, and their quality of life. I have worked with thousands of patients, from men in their early 60s just beginning to notice changes, to men in their 80s who thought their discomfort was simply something they had to live with forever. And I am here to tell you something important. The daily struggles you might be experiencing, the pressure, the urgency, the interrupted sleep, they do not have to define your golden years. In this video, I'm going to walk you through three powerful yet simple techniques that can provide real relief for prostate discomfort. The first technique involves daily exercises that take less than 5 minutes, but can strengthen the very muscles that support your entire pelvic region. The second technique focuses on a specific type of movement that most men completely overlook, yet it can dramatically improve circulation and reduce inflammation in ways that will surprise you. And the third technique involves a simple adjustment to something you do every single day. Something so basic that when I tell my patients about it, they often say they wish they had known about it decades earlier. These are not complicated medical procedures. They are not expensive treatments that require prescriptions or appointments. They are practical, natural approaches that work with your body's own healing ability. And here's what makes this even more important. I have seen men who felt hopeless, who thought their best days were behind them, experience remarkable improvements in their comfort and energy levels by applying these three techniques consistently. But before we dive into these techniques, I want you to understand something crucial about what is actually happening in your body after 60. Most men think that prostate discomfort is simply about the prostate itself getting larger, but that is only part of the story. What really happens is that multiple systems in your body begin to work less efficiently together. Your pelvic floor muscles, which act like a supportive hammock for all your internal organs, begin to weaken. Your circulation slows down, meaning less oxygen and fewer nutrients reach the tissues that need them most. Your posture changes, often without you realizing it, creating pressure patterns that your body was not designed to handle long term. Think of it like this. Your pelvic region is like a finely tuned orchestra. When you are younger, all the instruments play in harmony. The muscles provide steady support, the blood flows smoothly, the nerves communicate clearly, and everything works together beautifully. But as the years pass, some instruments begin to play out of tune. The muscles lose their strength and coordination. The circulation becomes sluggish. The communication between different parts becomes less clear. What you feel as discomfort is actually your body telling you that the orchestra needs some attention, some retraining, some gentle guidance to find its rhythm again. The good news is that unlike a broken instrument that needs to be replaced, your body has an incredible capacity to relearn, to strengthen, and to heal, even after decades of wear and tear. The techniques I'm going to share with you work because they address the whole orchestra, not just one instrument. They help restore coordination between your muscles, improve the flow of nutrients to your tissues, and create the kind of internal environment where healing can happen naturally. Let me start with the first technique. And this one might surprise you because it involves muscles that most men have never consciously thought about, let alone exercised. I am talking about your pelvic floor muscles. These are the muscles that sit like a supportive basket at the bottom of your pelvis, holding up your bladder, supporting your prostate, and helping control urinary function. For most of your life, these muscles have worked automatically, without any conscious effort from you, but after 60, they need your attention. The exercise that can help strengthen these muscles is called a Kegel exercise, named after Dr. Arnold Kegel, who first developed the technique. Now, I know what some of you might be thinking. Kegel exercises are for women, right? That is a common misconception. Men have pelvic floor muscles too, and they are just as important for male health as they are for female health. In fact, for men dealing with prostate discomfort, strengthening these muscles can provide relief that many find remarkable. Here is how to do a proper Kegel exercise. First, you need to identify the right muscles. The easiest way to do this is to imagine that you are trying to stop the flow of urine midstream. The muscles you would squeeze to do that, those are your pelvic floor muscles. You can also think of it as gently lifting the muscles between your legs, as if you are trying to lift them up into your body. Some men find it helpful to imagine they are trying to pick up a marble with these muscles. Once you have identified the muscles, the exercise itself is simple. Squeeze these muscles gently and hold the contraction for 3 to 5 seconds. Then relax completely for 3 to 5 seconds. That is one repetition. The key word here is gently. You are not trying to strain or force anything. Think of it as a gentle, controlled lift, like you are slowly picking up something delicate. Start with 10 repetitions 3 times a day. You can do these exercises anywhere, anytime, because no one can tell when you are doing them. You can do them while sitting in your favorite chair, while watching television, while waiting in line at the store, or even while lying in bed. The beauty of Kegel exercises is their complete privacy and convenience. Now, here is what many men do wrong when they first start Kegel exercises. They try too hard. They hold their breath, tense their stomach muscles, squeeze their buttocks, or tighten their thigh muscles. None of this is necessary, and it actually makes the exercise less effective. The goal is to isolate and strengthen just the pelvic floor muscles while keeping the rest of your body relaxed. Another common mistake is expecting immediate results. Like any form of exercise, strengthening your pelvic floor muscles takes time and consistency. Some men notice improvements in comfort and control within a few weeks, while others may need to practice for several months before they see significant changes. The key is patience and persistence. These muscles have been weakening gradually over years or even decades. Rebuilding their strength is not going to happen overnight, but it will happen if you stay consistent. What makes Kegel exercises so effective for prostate relief is that stronger pelvic floor muscles provide better support for the prostate gland itself. They also improve circulation in the entire pelvic region, helping to reduce inflammation and promote healing. Additionally, stronger pelvic floor muscles can improve urinary control, reduce the feeling of incomplete emptying, and even help with the urgency that disrupts sleep. I want to share something with you that I tell all my patients who are just beginning this journey. The most important thing is not how perfectly you do the exercises at first, but that you start doing them consistently. Your body is incredibly adaptable, and even small, imperfect efforts repeated daily will create positive changes over time. Think of it as having a conversation with your body, a daily check-in where you are saying, I am paying attention to you, I am taking care of you, I am not giving up on you. But Kegel exercises are just the beginning. While you are building strength in your pelvic floor, there are 2 other techniques that work synergistically with these exercises to provide even greater relief and comfort. The second technique I want to share with you focuses on something that happens to virtually every man as he ages, yet it receives almost no attention in discussions about prostate health. I am talking about the gradual loss of hip mobility and the way this seemingly unrelated change creates a cascade of problems throughout your entire pelvic region. You see, your hips are not just joints that help you walk. They are the foundation of your entire pelvic structure. When your hips become tight and restricted, which happens naturally as we age due to years of sitting, driving, and reduced activity, they pull on the muscles and tissues throughout your pelvis. This creates tension patterns that your prostate feels directly. Think about it this way. Your pelvis is like a bowl and your prostate sits inside that bowl along with your bladder and other organs. When the shape of the bowl changes due to tight hips and altered posture, everything inside that bowl gets squeezed and compressed in ways that create discomfort. The blood vessels that supply your prostate get pinched. The nerves that control sensation get irritated. The lymphatic drainage that removes waste products gets sluggish. But here is the remarkable thing. When you restore mobility to your hips through specific, gentle movements, you create space throughout your entire pelvic region. It is like loosening a belt that has been too tight for years. Suddenly, everything inside can breathe again, function better, and begin to heal. The movements I'm going to teach you are not complicated stretches that require flexibility or strength. They are gentle, controlled motions that anyone can do, regardless of their current physical condition. The key is understanding that we are not trying to force anything. We are simply reminding your body of movements it used to do naturally, helping it remember how to create space and flow. The first movement is what I call the seated hip circle. Sit comfortably in a chair with both feet flat on the floor. Place your hands on your knees for support. Now imagine there is a small circle drawn on the seat beneath you, about the size of a dinner plate. Slowly move your pelvis in a clockwise direction, as if you are trying to trace that circle with your tailbone. The movement should be so gentle that someone watching you might barely notice it. As you make these slow circles, pay attention to any areas that feel tight or restricted. Do not try to push through the tightness. Instead, slow down even more when you encounter resistance, allowing your body to gradually soften and release. Complete 5 slow circles in one direction, then reverse and do 5 circles in the other direction. The second movement is the gentle pelvic tilt. While still sitting in your chair, place one hand on your chest and one hand on your lower abdomen. Very slowly, tilt your pelvis forward by gently arching your lower back, then tilt it backward by gently rounding your lower back. The movement should be small and controlled, like you are slowly rocking back and forth on a rocking chair. As you do this movement, breathe deeply and naturally. Many men hold their breath when they first try these movements, but breathing is essential for the technique to work. The breath helps your nervous system relax, which allows the muscles to release tension more easily. The third movement addresses something that affects every man who spends time sitting, which in our modern world is practically everyone. It is called the seated spinal wave. Sit up straight in your chair and imagine that your spine is like a gentle wave in the ocean. Starting from the top of your head, slowly create a wave-like motion that travels down through your neck, your upper back, your middle back, and finally into your lower back and pelvis. This movement helps restore the natural curves in your spine that get flattened and compressed from prolonged sitting. When your spine moves freely, it takes pressure off the nerves that control your pelvic organs, including your prostate. It also helps improve circulation throughout your entire torso. The remarkable thing about these movements is that they work immediately to create space and improve circulation, but their real power comes from consistency. When you do these gentle movements daily, you are essentially teaching your body to maintain better alignment and mobility throughout the day. Your nervous system begins to remember what normal feels like, and it starts to maintain that normal state even when you are not actively doing the exercises. I recommend doing these movements twice a day, once in the morning to prepare your body for the day ahead, and once in the evening to release any tension that has accumulated. Each session should take no more than 5 minutes. You can do them while watching the news, listening to music, or even during commercial breaks if you watch television. Now, let me share the third technique with you, and this one is so simple that it almost seems too basic to be effective. But I can tell you from years of clinical experience that this single adjustment has provided more immediate relief for my patients than any other single intervention I recommend. It has to do with how you sit, specifically the position of your pelvis when you are seated. Most men over 60 spend a significant portion of their day sitting, whether it is in a favorite armchair, at a desk, in the car, or at the dining table. And most men sit in a way that puts tremendous pressure on their prostate without even realizing it. Here is what typically happens. When you sit in a conventional chair, your pelvis tilts backward, which causes you to sit on your tailbone rather than on your sitting bones. This backward tilt compresses everything in your pelvic region, including your prostate. It is like sitting on a garden hose. The flow gets restricted, pressure builds up, and discomfort follows. The simple adjustment is this. Sit on the front edge of your sitting bones, not on your tailbone. To find your sitting bones, place your hands underneath you while sitting and feel for the 2 bony points at the bottom of your pelvis. These are what you should be sitting on, not the tailbone behind them. When you sit properly on your sitting bones, your pelvis naturally tilts slightly forward, which creates space in your pelvic region instead of compression. It is like removing the kink from that garden hose. Suddenly, circulation improves, pressure decreases, and your prostate can function in a more natural environment. To help maintain this better sitting position, I often recommend that my patients use a small cushion or rolled towel placed at the back of their chair, right at the level of their lower back. This support helps maintain the natural curve in your spine and makes it easier to sit on your sitting bones rather than slouching back onto your tailbone. You might find that this new way of sitting feels unfamiliar at first, maybe even slightly uncomfortable. This is normal. Your body has adapted to sitting in a compressed position, and the muscles that support good posture may have weakened over time. Start by maintaining this better position for just a few minutes at a time, gradually increasing the duration as your body adapts. The beauty of this technique is that it works immediately. The moment you shift from sitting on your tailbone to sitting on your sitting bones, you create more space for your prostate. Many of my patients tell me they feel the difference right away, describing it as a sense of relief or opening in their pelvic region. These three techniques, daily Kegel exercises, gentle hip mobility movements, and proper sitting posture, work together to create what I call a supportive environment for your prostate. They address the underlying mechanical and circulatory issues that contribute to discomfort, rather than just masking symptoms. But I want to be completely honest with you about what to expect. These are not magic solutions that will transform your comfort overnight. What they are is a gentle, natural approach that works with your body's own healing capacity. Some men notice improvements within the first week, particularly with the sitting adjustment. Others find that it takes several weeks of consistent practice before they experience significant relief. The key is understanding that every small action you take is building toward better health. Each Kegel exercise is strengthening muscles that support your prostate. Each gentle hip movement is improving circulation to tissues that need it. Each time you adjust your sitting position, you are reducing pressure and creating space for healing. I have seen men who were getting up 4 or 5 times each night gradually reduce that to once or twice. I have worked with patients who felt constant pressure and urgency discover that they could go hours without thinking about their bladder. I have watched men regain confidence in social situations, no longer worried about where the nearest restroom might be. But perhaps most importantly, I have seen men reconnect with a sense of control over their own bodies. Instead of feeling like victims of aging, they become active participants in their own wellness. They wake up each morning knowing that they are doing something positive, something that honors their body and supports their comfort. Your prostate health is not something that happens to you. It is something you can influence, guide, and improve through consistent, caring attention. The techniques I have shared with you today are your tools for that journey. They require no special equipment, no prescriptions, no appointments. They ask only for your time, your patience, and your commitment to your own well-being. If you found this information helpful, I encourage you to start with just one technique today. Choose the one that feels most manageable for you right now. Practice it consistently for a week, then gradually add the others. Remember, small steps taken consistently create lasting change. Thank you for taking this time to invest in your health. Your comfort, your peace of mind, and your quality of life matter. And with these simple tools, you have everything you need to begin creating positive change starting today.